friends, welcome back to Nurse's Nook and Corner. Come, let's make it easy. If you didn't subscribe the channel, don't forget to subscribe and press the bell icon to get your updated videos. Today in this video, we are going to have a brief outline about Nmc Osce in UK. First of all, what is an OSCE? It is an objective structured clinical examination. The main aim of it for nurses is to assess their clinical and communication skill to practice nursing in UK. Now it's time to know about the steps to reach your goal to practice nursing in UK. The first step is OET, that is Occupational English Test, which assesses your English skills for to work and live in an English-speaking environment. The second step is NMC registration, that is the Nursing and Midwifery Council UK, which is an independent regulator for nurses, midwives and nursing associates. You have to enroll your registration in NMC. The third step is CBT, that is computer-based test, which contains 120 multiple choice questions to test your ability and knowledge to practice nursing safely in UK. The fourth step is OSCE, that is Objective Structured Clinical Examination, and finally if you success with OSCE, then you can get your UK Nursing and Midwifery Council PIN number as registered nurse. So these are the 5 steps to reach your goal to practice nursing in UK. Now let's see about the OSCE overview. There are totally 10 stations in OSCE, in which 4 stations are APIE station, 4 stations are skill station and 2 stations are silent stations. In APIE station and skill station there will be real or mannequin. Let's see in detail in next slide. So what is an APIE station? It contains 4 stations. In that, the first station is A, assessment, P, planning, I, implementation and E, evaluation. The assessment, it takes about 20 minutes, and P, planning, it takes about 14 minutes, I, implementation, which takes about 15 minutes, and E, evaluation, which takes about 8 minutes. So this is the APIE 4 stations. The next 4 station is your skill station. You may get any of the following procedures from out of 22. The first is administration of inhaled medication, blood glucose monitoring, catheter specimen of urine, fine bore NG tube, fluid balance, in-hospital resuscitation, intramuscular injection, oral care plan, oxygen therapy, IV flush and VIP scope, pain assessment, peak expiratory flow rate, pressure area assessment, removal of urinary catheter, subcutaneous injection, MS midstream urine and urine analysis, wound assessment, aseptic non-touch technique, administration of suppository, bowel assessment, nutritional assessment and nasopharyngeal suctioning. So these are the 22 procedures, in which out of these 22 you may get any 4 of the following. In skill station, the time duration varies for each procedure. So the time duration has been mentioned. For example, if you are going to do the procedure of administration of inhaled medication, it should be completed with 12 minutes. If you are going for catheter specimen of urine, then it should be completed within 8 minutes. If you are going for in-hospital resuscitation, no defibrillation, means it should be completed within 6 minutes. So these are the various time duration mentioned for each station. So any of the 4 only you will be getting in skill station. Next 2 stations are silent station. The first station is evidence-based practice. It takes about 10 minutes. So there are totally 14 procedures. The first is ankle sprain, Asperger's syndrome, bedside handover, cervical screening, Canberry juice and urinary tract infections, dementia and music marking criteria, diabetes marking criteria, then female myocardial infarction, fever in children, pressure ulcer prevention, restraint, saline versus tap water, smoking cessation, use of honey dressing for venous leg ulcer. So out of this 14, you will get any one of the following as evidence-based practice, which you can complete within 10 minutes. The second silent station is professional value, which is also will be given 10 minutes. In this totally 15 procedures are there. The first is hospital food, impaired performance, laboratory results, possible abuse, professional confrontation, racism, social media, bullying, concealment of bed status, confidentiality, drug error, false representation, falsifying observation, falsifying timesheets, witnessed abuse. So out of these 15 procedure, you will get any one for professional value. So for 10 minutes, you have to complete this station. So till now you have seen about the various 10 stations that you're going to attend for OSCE. So how difficult it would be? It varies from person to person. I hope the program will help you to feel more confident and ready for your exam. The main challenge is that you need to constantly verbalize your thoughts and rational to the assessor. So this is an example slide. So you have to explain out loud each stage you're doing. For example, with a kettle and cup, I'm taking the kettle to the sink, I'm taking the lid of the kettle, I'm turning the tap on and filling the kettle with cold water. So talking out loud and explain your action is most important in OSCE. So you have to be loud enough and clear cut while you're doing the procedure. The first important thing is being loud. The second thing is time management. So you have to be in time. Station timing is limited. So for each procedure they have given a time period. Within that you have to complete the time and vary from skill to skill. So each procedure have various times. So within that time period you have to complete and you have to be attention whether you're within the time. So manage your time. So the simple strategy to complete an OSCE is just you have to remember with pre-procedure, procedure and post-procedure. Let's see one by one. Pre-procedure. What should I do? The first is I have to check for scene is safe. The second is I have to do for hand washing because to prevent infection for myself and to the patient. Then third thing is promoting privacy to the patient. Fourth, introduce yourself and the purpose for doing the procedure. Fifth is confirm your patient's identity with ID band. And sixth is you have to check your patient's comfort, pain and allergic status. And seventh is that you have to gain consent. So these are the 7 pre-procedural steps you have to do. So the next is procedure. What should you do? Procedure with specific skill. You will need to prepare with marking criteria and deliver the skill. Try to verbalize each and every step loudly to the patient. If you left any steps or wrongly did, just verbalize with the assessor then itself. So these are the 4 things you have to remember during the procedure. So for each procedure, the steps vary and it would be uploaded in the next videos. In post procedure, what should I do? So the 6 steps you should remember. Ensure your patient has no other concern. Checking the patient comfort again. Ensuring your patient has the call bed and bedside table within reach. Ensuring your documentation is completed. Hand washing. And don't forget to pull back the curtain. So these are the 6 post-procedure steps you should remember. Till now you have learned about the procedure and steps to do in OSCE. The next is OSCE centers. There are 5 approved OSCE test providers. The first is Oxford Brookes University, University of Northampton, Ulster University, Northumbria University, Leeds Teaching Hospital, NHS Trust. These are the 5 approved OSCE test providers. Next, see about the OSCE cost. Full on new OSCE application, the cost is £794 sterling, which is effect from 1st April 2019. This is non-refundable in the event of cancellation. So this has been taken from the NMC website. If you fail in OSCE, a partial reset will cost £397 sterling. That is, if you fail in 1 to 7 stations, only a partial reset will be happening. If full reset will cost £794 sterling. That is, if you fail in 8 to 10 station, you have to have a full reset. It has been effect from 1st April 2019. So it has been taken from the NMC website. So how will you get your OSCE result? Results via email within 15 working days of the date of your OSCE. And if you pass your OSCE, you will get an email with details of what to do next. If you fail in OSCE, you will get an email with feedback on which stations and elements you were unsuccessful in. So till now we have seen about the OSCE overview. In upcoming videos, let's see about the assessment and the procedure steps. Success is dependent on effort how you put. So all the best for your OSCE. In next video, we'll see about the assessment station. So let's go one by one station. The first station is assessment. So let's see in next video. If you didn't subscribe the channel Nurses Nook and Corner, don't forget to subscribe and press the bell icon to get your updated videos. Thank you for watching.